A lot of times we'll see the patient as when they initially come in, either in combination with the doctor, or sometimes we'll see them do an initial evaluation ourselves. They go through this process. They have a insurance process they have to go through to get approved for bariatric surgery before we can actually proceed with surgery.
And we have people in the office that help with paperwork to get approved for bariatric surgery. Once the patient has been approved for bariatric surgery, they do have to go to another class called Begin, which talks about their liquid diet prior to surgery, which is about a 10-day liquid diet, so they can lose weight and shrink the liver and the intestines so the doctor can see what they're doing during the operation. The post-op diet is also a liquid diet progression to solids over about a 6-week period of time.